I'm about to start my shift as a family doctor in the office, but I wanted to do a quick video on signs that you might be depressed or how to tell if you have depression, because honestly, I am seeing so much of this lately. This is not for you to diagnose yourself. This is for you to sort of think about and say, hey, maybe it's time for me to see my doctor. All right, so the first thing is a little interest or pleasure in doing things. This is often a symptom that many of my patients will mention. They'll say, I used to love to play tennis, or I used to love to sing in the choir, or go to the movies, or do this. And honestly, now I just don't even care. I don't have much interest in doing the things I used to do. I don't find pleasure in a lot of things that I used to find pleasure in. So think about, is that you? The other thing is feeling down, depressed, or hopeless, or any of the three. Now, it sounds self-explanatory, but when I say it like that, I'm hoping you really think about what this means. Feeling down, just feeling melancholy, feeling depressed, feeling hopeless, like there is no hope. That is a very common sign of depression. Also, trouble sleeping. It doesn't have to be trouble falling asleep. It doesn't necessarily have to be trouble staying asleep, although those can be symptoms for some people. For some people, it's that they sleep all the time. All of a sudden, they don't want to be awake, or they'd rather be asleep than be awake, or they're sleeping more than normal, okay? The other thing is feeling tired and having little energy, just sort of being blah. Feeling blah, feeling fatigued, feeling tired, low energy, just low. And then the other thing is appetite. Appetite is something that changes with depression. Also, anxiety can happen as well. But some people develop poor appetite, where their appetite just sort of goes away. Other people actually eat more. And they may overeat, okay? So sometimes even with, things like depression, we notice either weight gain or weight loss. For some people, that is a sign or a symptom. Another big symptom, actually, this happens a lot, is, what's the language that you use what's the language that you use with yourself? Do you find that you're doing a lot of negative self-talk? Like, oh, you're so stupid. Why did you do that? Or I can't believe you forgot the keys again. Or, you're such a bad mom. Like, why didn't you blah, 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 blah. Or you're not a good wife, or you're not a good husband. That sort of negative self-talk about how we talk to ourselves, that can be a sign of a larger issue, guys. And by the way, that's really important. That sort of tape that we play in our heads, Also, trouble concentrating. Now, this is a really big one, because sometimes people just notice that they just have trouble concentrating, right? Usually they have other symptoms too, don't get me wrong, but this is a big one. And it can be that you notice it at work or at home, or with tasks or chores that you have to do. You're just not able to concentrate. You're distracted. You're kind of all over the place. Also, some people move so slowly or talk so slowly that other people notice, whereas likewise other people get fidgety in terms of their depression, in terms of depression symptoms. So are you kind of like always like or just like and in a way that other people notice? Maybe those aren't good descriptions or ways to describe it, but you get what I'm trying to say. Thoughts of hurting yourself. By the way, you should always seek medical care. If you feel like this, you need to call 911 or call the suicide prevention hotline. I got the number here, 1-800-273-8255. Guys, that's super, super important. Always reach out immediately if you feel that way. But look, if you feel any of these symptoms, please make sure you talk to your doctor. Also, just know you're not alone. Guys, I'm Dr. Jen Caudle. Please let me know if this was helpful. Let me know what you're going through. Let me know what's been helpful for you. If you've not liked and followed my page, I invite you to do so. And for those of you who send stars, thank you so much. I respond to you personally. Also consider joining my subscription groups for exclusive content. For those of you on YouTube, hello. Please subscribe to my channel and click the little bell for updates. Guys, I'm Dr. Jen. I'll see you soon.